Good morning and welcome to the 10th lecture in our series, Healthy Aging. My name is Rebecca Van Dyke and I'm a volunteer with Ollie and have the pleasure of moderating today's lecture. The Healthy Aging series is a collaborative event between Ollie and the Turner Senior Wellness Program. Our topic today is Readiness for an Emergency. What do seniors need to know? With Dr. Sue Ann Bell from the University of Michigan Nursing School. Before we get started, just a few reminders about Zoom. The main thing to know about is the Q&A icon. To submit a question for Dr. Bell, simply click the Q&A icon, which is in the center bottom of your viewing window. You'll type the question and submit it, and it will go to the moderator, which is myself. While there is also a chat function, please don't use the chat icon for questions after the lecture. Please use the Q&A. Please note that we now have a closed caption option for you to use if you wish. On your Zoom control computer screen, you will see an icon labeled CC in the meeting controls. Click on it for either closed caption or a live transcript of the presentation. If you're having technical issues such as your screen freezing, the best way to alleviate that is to get out of the meeting and re-sign up again with the link that you got this morning. If technical difficulties persist, call the Turner office at 998-9353. I'd also like to call your attention to the next lecture in this series. On Friday, March 25th at 10 o'clock, our lecture will be Firearm Safety Among Older Adults. Mark it on your calendars. Now to today's lecture. First, the legal disclaimer. The views expressed during the lecture and the Q&A do not necessarily reflect those of the University of Michigan and Ollie. As usual, we'll have about a 45 to 60-minute presentation followed by 30 minutes of Q&A. It's now my pleasure to introduce our speaker. Dr. Bell is a nurse scientist and family nurse practitioner with expertise in disaster response, community health, and emergency care. And she's an assistant professor in the University of Michigan School of Medicine. Her research focuses on the health effects of disasters and the impact of climate change on human health within a health equity framework. She is clinically active in disaster response through the U.S. Department of Health and Human Services National Disaster Medical System, with recent deployments to Hurricane Irma, Hurricane Marie, and the California wildfires. Thank you so much for joining us, Dr. Bell. I will now turn it over to you.
Thank you so much for having me today. I'm really thrilled to be here. I'm going to share my screen and get started. So I appreciate the introduction and look forward to talking with you all today about some of my work and about how we can be ready for disasters. So the way this talk is organized is into 5 parts. I'm going to start by introducing myself a bit more. We're going to talk about disaster definitions and disaster impacts. I have 2 case studies to present about recent disaster deployments that I've been on. We'll talk about readiness and the disaster management cycle, and then end with some key considerations for older adults. So as Dr. Van Dyke mentioned, in my day-to-day life, I'm a assistant professor at the University of Michigan School of Nursing, where you can usually find me sitting in front of a computer, looking at data, writing grants, and writing research papers. But I'm also an on-call nurse practitioner for the National Disaster Medical System, which I'll tell you more about in the case study part. But this is an introductory slide I'd like to share of when I deployed to Hurricane Irma in 2017. And you can see the blue arrow is pointing to my head shortly before, as we took a C-17 and landed actually with night vision at the Orlando airport, and then I responded to Hurricane Irma for the next couple of weeks. I always like to start with definitions, and this is the formal definition of disaster that I use. And you can see on the bottom, IFRC is the International Federation of the Red Cross and Red Crescent. This is the definition of disaster that they use. And I focus on the equation part in red, which is when a vulnerability combines with a hazard and exceeds capacity. That is what a disaster is. So a disaster, as we'll talk about a bit more, doesn't have to be a hurricane or a severe storm. A disaster can be any number of things that exceed the capacity of a community or a group of individuals to address the event. You won't find me saying that using the term natural disaster. I try to think of disasters as specific events, or I might say disaster event, but the hazards themselves are naturally occurring. So that could be a hurricane or a tornado or a volcano. And these are things that are going to occur naturally that we can't prevent. But it's the impacts that they have on society and on infrastructure that really make it a disaster. So the implication of saying that a disaster is natural implies we can't do anything about it when really we can. So for example, the picture on my left is of the flooded Amazon River basin, which occurs seasonally and is actually something that is supportive for the environment. And you can see the picture on the right is the city of New Orleans after Hurricane Katrina. A city that was built in a low-lying area that experiences some degree of flooding and had aging infrastructure in the levees that failed, that contributed to the catastrophe that was Hurricane Katrina. We also know that disasters affect individuals and communities in society that already have a number of challenges, namely that's around poverty and race, and also individuals who are older and have disabilities. So we see after disasters, Hurricane Katrina, for example, the recent Camp Fire in Paradise, California, the group of individuals that had the highest morbidity and mortality was older adults. This is a picture after Hurricane Katrina again of a nurse named Mary Jo D'Amico, who was supporting a group of patients from the extended care facility. And she's standing right above her is the helicopter landing pad. And these individuals had been waiting any number of days to be evacuated out, and they were among the last to be evacuated. And this picture eventually turned into a Pulitzer Prize winning article and a book called 5 Days at Memorial, which is a really excellent read that I highly recommend, that details some of the ethical challenges around caring for medically complex individuals in a disaster, and also details some of the failures in disaster planning that occur at the health system level and for communities that have disproportionate effects after disasters. So as I've mentioned, my research is around how disasters affect individuals and communities and what those long-term health effects are. So getting back to the definition of disaster that I shared already, when I think about disasters and aging, I think about some of the unique challenges that affect older adults, not all older adults, but many older adults, so that when we think about planning and readiness for a disaster, some of the things to take into consideration for planning are around chronic and comorbid diseases. We know that older adults have at least 80% of older adults have at least one chronic condition. Many have multiple chronic conditions, and that's going to impact caring for those conditions is going to impact readiness for disasters. Social isolation is a phenomenon that becomes more common with aging. Cognitive impairment as well. For some individuals, and as aging advances, frailty, and many live on a fixed income. So when we're thinking again about a vulnerability combining with a hazard, we have to think about what some of those vulnerabilities are so that we can take steps to address what those are. So disaster planning, especially for older adults, does incorporate many of these risk factors, if you will, into planning. And that's also something that as you're thinking about your individual planning and readiness for a disaster, taking some of these considerations into account becomes more important. We also know that disasters are occurring with more frequency and severity. And this is an infographic that comes out of NOAA and is updated every year. This is from 2021, and we can see that there were 20 separate billion-dollar weather and climate disasters that impacted the US in 2021. So that's not to say that there were $21 billion disaster events. Many of these events that you see, like the Western wildfires, for example, had huge economic impacts. And I actually emailed the scientist that produces this slide every year to ask permission to use this slide. And I asked him, how are you measuring the economic impacts in these billion-dollar disasters? And I specifically asked him, are you taking into account health and health effects from disasters? And there's a very fairly advanced inputs that go into this number, but they don't take into account, as I'm told, some of those short and long-term health impacts and the cost of those health impacts, which for me as a researcher is where I focus, is thinking about what are those health impacts and what are those economic impacts and how can we better quantify those. So I want to just switch to talk about two case studies of disaster deployments that I've done and what I've learned from them about readiness for disasters. So as I've mentioned, I'm on a disaster medical assistance team. In this role, I become an intermittent federal employee when I'm deployed to a disaster. So I take around 4 months of call every year. And I commit to a 2-week deployment minimum if I am called to deploy. And I also commit to a 2-hour notice to deploy. So I'll talk about that in an upcoming slide. But the other interesting thing about this position is, I'm a faculty member at so I teach, I do research, so having a 2-hour notice to deploy can be quite a challenge, and one that fortunately University of Michigan has been highly supportive of me going. But for as an intermittent federal employee, I'm subject to the Uniformed Services Employment and Reemployment Act's right, which is similar to the National Guard in that I cannot be penalized by my employer for responding, for deploying. So some of the benefits of this role is that I get some of the highest disaster training available. And for me, what is most important to me is that I get field experience and I'm able to deploy to disasters. I also get workman's comp as well. So some of that, as I mentioned, the highest level of disaster training available was never more relevant than during the COVID-19 pandemic. So this was July 2019. I spent a week at the University of Nebraska training in their National Emerging Special Pathogen Training and Education Center. So I spent a week learning how to put on or don and take off or doff personal protective equipment. And actually, when I had the opportunity to do this, we worked, as you can see in the picture on my left, I'm wearing a PAPR, which is a powered air purifying respirator, which allows, is a closed system, allowing, no outside air to come in within when you're wearing this level of personal protective equipment, or PPE. And then the picture on my right is, the red arrow is me as we are practicing a simulation. So caring for a patient with highly infectious disease. And in this simulation, it was a patient with Ebola virus disease. And we're learning how to transfer a patient and then start providing some basic care in an environment where the respirator is blowing in your ear, so you really can't hear anything. And so you're relying on a whiteboard and almost reading lips in order to communicate. The other thing is that the suits are incredibly bulky. So I think if you can see my purple hands, I think I'm wearing 3 pairs of gloves, and one pair is like a set of kitchen gloves that you'd conceivably wash dishes with. So trying to do some normal movements and patient care become really, really challenging. And about as we were in the process of transferring this patient and getting them set up, there was a simulated, the patient vomited in a simulation. And I learned maybe for future Halloween or something like that, that the simulated vomit was oatmeal mixed with coffee grounds. So I couldn't, it really did look like the real thing. But then we had to learn how to clean up the patient and avoid contact with the vomit, and as part of our training. And I can say that it was quite the challenge. So that training was especially important when in March of 2020, I was deployed to the Princess cruise ship quarantines to care for some of the first known patients in the United States with COVID-19. So I am not in this picture below, but my role was to support the individuals who were in the federal quarantine facilities. This is my friend Ryan and I, who were deployed to the quarantine facility. And in this role, we provided basic health care and regular monitoring to individuals who were quarantined. And then we monitored symptoms and made transfer arrangements for people who were showing early signs of infection. And that actually did happen with some regularity over the 14 days that I was there. And in this picture, we're wearing the PPE, or the personal protective equipment that was required at the time. We did have people from the representatives from the Centers for Disease Control who were on site with us, who were advising us about the latest information that was known about this very new virus. And at the time, this was the recommended PPE, although I'll say we wore shoe covers when we went into the hot zone. And this is Ryan and I, as we had just donned or put on our PPE before we were going into the hot zone, where we had we were in the cold zone going into the hot zone, where we had contact with what the individuals who are in quarantine. So people will often ask me, like, what does it look like when you're there? What are you doing? And I will say that quite often there's a lot of downtime, so I usually try to work nights. And in the picture on my right is I took 4-hour shifts in PPE inside in the hot zone, or in the facility. And this is where the cot right there is where I would try to get some rest because it was the middle of the night. the picture on the left, I get asked frequently, well, what do you do about your, keeping up with your research and your teaching and your day job? And I always say, NIH, National Institute of Health deadlines wait for no one. And so without fail, on any downtime I have, I'm usually trying to keep up with grant writing. So I did want to say that thinking about readiness for older adults, the individuals who were quarantined, the cruise ship passengers, were almost entirely a group of older adults who were some of the kindest, most positive, relaxed people that were, making the best of really a terrible situation. And it really was like, fairly inspiring to be myself, feel scared and anxious and nervous about, what was happening with COVID, and be around a group of people who, had a lot of positivity. I would say when thinking about readiness, this was a group of people who, we're talking about emergency preparedness, and there was no emergency preparedness. They were on a boat, and then they couldn't go home for a number of weeks. The federal government was running the quarantine facility and worked to support getting prescriptions and Amazon packages delivered, and provide not just nutritious meals, but also, meals that were healthy. So I think no one who was in the quarantine would say, I'd do that again whatsoever. But I think I watched a group of people like displaying a lot of resilience, and that was really inspiring to me. I mentioned my own sort of fears about being there, because this was in California and I live in Michigan. So when I went to leave, when I was done and it was time to leave, there were flights being canceled and a lot of concerns at the time about perhaps airports would close. And so I really was worried about not being able to get home. And I actually was flying out of a smaller airport, and that airport canceled my flight over a number of days. So I was able to rebook myself and drove to Los Angeles. And I wanted to share that, one of the busiest highways in the United States, on any given day, this was 9 a.m. on like a Wednesday morning or something. So not going through almost downtown Los Angeles, no one on either side of the highway. And then I got to the airport, and again, there was virtually no one in the airport at all. So that was an experience I never thought I would see. I'm going to talk for a minute or two about, or 5 minutes or so, about my response to Hurricane Maria. So in this role, I deployed to support the US Navy ship, the Comfort. And you can see, I look about this tall in my left-hand corner of this giant hospital ship. And I'm actually standing on the cruise ship terminal dock in Old San Juan. And I'm facing the city of Old San Juan, or the community of Old San Juan, and you can see the small brown tents that were set up on the cruise ship dock. And in this deployment, our team provided healthcare of varying levels to residents of Puerto Rico, where my role as a nurse practitioner was to provide kind of basic primary care. This was thinking again about readiness and preparedness. The type of care I provided was, you might think it was injuries or trauma from the hurricane, but really the type of care that I provide and have provided in other hurricane settings is basic primary care and supporting individuals to meet their chronic health condition needs. So medication refills. We travel with a number of pharmaceutical supplies. So in this situation, we were able to refill many medications. We saw people with high blood pressure, blood sugar was high, just a lot of chronic pain, low back pain, shoulder pain from being again in a disrupted environment and doing things people might not normally do because there's no power or storm damage. Another thing I have seen frequently is around diabetes care, where a challenge is eating a healthy diet in order to meet your keep your blood sugar in check, or the same goes for other conditions that require a certain type of diet, and that's a challenge for people to meet when grocery stores are closed or they're eating shelf-stable meals. So this is a picture on my left, again, me working in the middle of the night, which I don't prefer to do at home, but I do prefer to do on deployments. And this is the tent where I provided care, usually to around 60 to 80 people a night, all through the night. And then the picture on my right is on the flight deck of the Comfort. And so you might ask about the role of the Comfort. So our role was to be kind of to provide care to like a first line of care. And if people needed more advanced care, then they would go to the Comfort. And then we also had the helicopter evacuation as needed. This is what the inside of the tent looked like. We are able to set these tents up in a very short amount of time, usually only around 2 hours, till we can start providing care. So I wanted to switch to the third part of my talk to talk about the disaster management cycle. So this is important for readiness because readiness is informed by all parts of this cycle, which is mitigation, preparedness, response, and recovery. So I'm going to go through each of these briefly. So mitigation is the reduction or elimination of future risk. And you might say, like, okay, well, what do I need to know about that? And I like to show this picture. This is a house in Mexico Beach, Florida, which was affected by Hurricane Michael, I think in 2018. And all around this beach community, houses were destroyed, but this house stayed standing, and it got a fair bit of press. And when they interviewed the owner of the house, who I believe his name was Dr. LeBron Lackey, if I'm saying that right, they said, what did you do? How is your house still standing? And he said, when it came to building codes, I went 20% above and beyond. So I built the concrete pilings 20% thicker. I went 20% above the bolts I needed to keep my roof on, or the thicker windows. So the end result of going 20% above was, in this instance, his house was still standing. So I always like to think of mitigation as, what if we can go 20% above in activities to protect our health or to protect our well-being, to eliminate some of those future risks that might come? What positive outcomes might we see from that? We are going to talk a lot more about preparedness in the next section of this talk. But those preparedness is those activities undertaken to address a disaster if it strikes. And you can see here some visual representation of preparedness in terms of an emergency preparedness kit in green on my left, and then a pandemic preparedness kit in orange on my right. Response is some of what I've just shown in the case studies, an immediate reaction or relief that saves lives. And this picture was a screenshot I took on my iPhone as soon as we landed in Orlando after Hurricane Irma that said, the hurricane warning is in effect, the storms are starting. And then recovery is the process of repair and restoration. And so I mentioned that it's the disaster management cycle, and specifically when it comes to recovery, there really is no clear end date of when you can say a community or an individual is recovered. This is a picture I took in Paradise, California, shortly after the fires had gone out, and when the community was still only open to first responders. And this deployment remains one of the ones that probably was just really challenging in terms of seeing the loss of life and the devastation to this, beautiful California community. So I hope some of what we've talked about so far shows that preparation or being ready for a disaster really does make a difference. I want to make the point that preparation is on a continuum. So it's not like today you'll get off this webinar and go to Target, buy all your supplies, and become prepared. But rather, I really hope that the takeaway message will be, what can I do today to take some incremental steps to being prepared? How can I get started if I haven't? Or how can I build upon the level of preparedness that I already have? So when I say preparation makes a difference, one thing decades of research has shown is that we still underprepare across, all age levels, all economic strata. Preparedness remains a bit of a conundrum in how to better support people to prepare, besides just telling them you need to prepare. And this was an interesting book that came out of the Wharton School of Business at UPenn. And this is one of my favorite quotes that I use a lot. We fail to evacuate when advised to do so. We rebuild in hazard-prone areas after experiencing a disaster. We don't wear helmets when riding motorcycles, and we'd rather avoid the risk of crying wolf than sound an alarm. And some of the points that this book makes are around these inherent biases that we have that maybe if we can think about what some of these biases are, we can help identify and address that these are some of the reasons why we don't prepare. So I wanted to spend a minute just kind of thinking about some of these and seeing if maybe any of them ring a bell, because when I read this book, I thought, I study disasters for, that is hopefully my life's calling. And I really see myself in a lot of these. So myopia is focusing, on the immediate future without thinking about, or focusing on these, what's immediately in front of you instead of thinking about some of those longer term risks. Many of us are undergoing right now what I like to call Ann Arbor amnesia, which is when you have a few beautiful days of spring, you forget all about the terrible winter that we've just gone through. And that can be the same for in disaster affected areas where, once the disaster is resolved, if you will, those steps you need to take to prevent the next one kind of fade away. People are optimistic. I call that a bias. It's also a good thing in many ways, but in this case, it leads to, the idea that we underestimate, a disaster, like it won't happen to me. Or what I've heard frequently in disaster affected communities, we had our big storm, we had our once in a life event, so we're not going to have that again. And research has really shown us that there really is no such thing anymore as a 500-year storm. So optimism is great in many cases, but when it comes to preparedness, I think focusing your optimism on how well prepared you are is the best place to think of, best place to be. Inertia, definitely I see that in myself. I'll prepare tomorrow, or I'll do this next time. So my father-in-law always likes to say the hard part's getting started, and that is definitely true here. So simplification, in terms of preparedness, that would be around focusing only on, I have, this part of my emergency preparedness kit. I have food and water, and not thinking about, have I told my family and my loved ones about my plan? So that's an important thing, is to think about, the big picture of preparedness. And then finally, the herd effect, where you're basing your decisions on the actions of others. So I wanted to talk for a minute about preparedness in older adults. And I believe this talk is sponsored in part today by the National Poll on Healthy Aging, where I had the opportunity to work with members of the team to do a survey of older adults. I think it was around 2,000, 2,500 older adults, where we asked them about their experiences with disasters, and how well they had taken preparedness into account, or taken some steps towards preparing. We found some really interesting findings. Some of that was that for the most part, the people, or the individuals in our survey, had a 7-day supply of essential medications. So we're able to get through at least a week with their regular medications. We found just over half had a 7-day supply of food and water. Less than half had signed up to receive local emergency alerts. And only around 40% had talked with family or friends about their evacuation plan. And this was another interesting finding, not on this infographic, is that among people who use medical equipment that requires electricity, which was a fairly small number of people in this poll, only about 25% had a backup power source in place, which was certainly a concerning part of the poll. So I wanted to start in thinking about preparedness, and I am not going to go through in this telling you how many cans of beans you need to have or what type of can opener, but really kind of give a bigger picture and point you towards some resources around preparedness and readiness. And I have some good old Campbell's soup here, because that's supposed to represent that there's a big information soup around what you need to do to prepare, and the various resources that you can pull from in order to prepare. And so I would suggest starting or building upon your preparedness by gathering the information that will help you prepare. So start by looking at some trusted websites. And I'd say the most trusted website that I consider is called ready.gov. And that's the US government's preparedness website, where it's intended to be a one-stop shop for information about emergency preparedness, whether you are an older adult, or someone with chronic conditions, or you want to know about how you can be prepared in terms of your pets. So that's the first thing to think about, is starting to gather that information that will help you be informed. Another important part of preparedness is identifying the hazards or the events that you might be at risk for. So in Michigan, where this talk is based out of, floods, severe storms, winter storms, wildfires, power outages, and tornadoes are the most common disasters that have affected the state of Michigan. There have been around 40 major disasters or presidentially declared disasters in the past 70 years, and floods and severe storms are the most frequent. One of the most notable is the Midland Dam failure that occurred, I believe, in 2020, that devastated a number of communities around the middle of Michigan. I get told with some regularity, well, I live in Michigan, I don't have to worry about disasters. And I can't tell you enough how much that makes me want to say, no. we are all at risk for disasters, and we're seeing new and unexpected disasters occurring with more regularity. Who would have thought, the past 2 years of the pandemic would have been something, if you asked me that in February of 2020, maybe not February, maybe December of 2019, I never would have thought, what we've had the past 2 years would be what it was. Some things that, in Michigan specifically that I think about are cyber attacks and being on a border with another country, the risk of terrorism, and I should say whether that's domestic or international terrorism. So this is a picture from ready.gov, I believe, an infographic from the Federal Emergency Management Agency that if you're watching this on the recording, this might be a good time to pause it and maybe print this, excuse me, slide out and check the boxes, go through and check the boxes to see where you are with each of these and what you can do. So these are kind of 12 essential steps to prepare. Signing up for emergency alerts, which we'll talk about maybe in the next slide or two, make a plan, financial considerations, practicing, getting to know your neighbors, getting involved in your community, thinking about evacuation, all essential steps in preparedness that I'm going to go through many of these. So I wanted to share emergency alerts and apps. So on a local level, hopefully these links are clickable or you can look at these on pause. Washtenaw.org, which is where we are in Ann Arbor. You can go to that page and sign up for their emergency alert system, which is through a product called Everbridge. Nationally, I recommend downloading the FEMA app to get information about recent and ongoing events, and also to get recommendations on preparedness. And I also recommend having a weather app, whether you look at that on your smartphone or on your computer. Weather Underground is one of many. That's the one I use. There's others as well. And if you go to Weather Underground, there's an app that you can download or be directed to download. So I highly recommend subscribing to emergency alerts and having apps on your phone so that you can keep track of current and impending risks. A family communication plan is an important part of readiness that quite often is, as we saw in our poll, is not as common as we hope it might be. This is one of many that are downloadable from the internet. In fact, you can type in family communication plan and come up with any number that might work for you the best. I like this one because you can post it on your fridge. You can print it out and share it with your family and loved ones. That details when we evacuate, where will we meet, what's your out of area emergency contact, what those important local numbers are, and 2 evacuation routes that you're going to think about. Financial considerations are really, really important and sometimes not talked about enough. So I wanted to just go through these pretty plainly. It's taking the steps to gather your financial and critical personal, household, and medical information is important. Making a copy is important. I know FEMA is moving towards not requiring the originals. Many people keep these documents in a safety deposit box. Other people choose to have these documents in a fireproof box. I know, for example, my parents have, my mom and dad have shared a lot of this information with my sisters and I in writing that we keep in our important documents area in our house. Having a small amount of money saved, and I recommend having an emergency savings account that you'd think about, that you'd use in the event of an emergency, but also having a small amount of cash at home in a safe place is important. Sometimes I get asked, well, how much cash? I think that's really a personal decision, but I would emphasize that it doesn't need to be a huge or enormous amount, enough that if you unexpectedly need to pay for a couple nights hotel and dining out or a grocery store trip, that's what I'd recommend. It's always a good idea to, if you don't have insurance, to have insurance, but to regularly check on those policies to make sure that you're meeting, the needs of the community, the risks of the community, and that those are regularly updated. And to keep in mind, not all insurance policies are the same or cover the same things. So having a frank conversation with your insurance provider about risks in your area is important. So we're thinking about readiness. Financial exploitation and scams are a real thing. So be very cautious about sharing personal financial information. And I know you might think like, I know, I've heard this 100 times. It's really helpful for me, for other people to continue to hear it, because just this week, I got a phone call from Amazon asking me to approve a purchase for a MacBook Pro. This was not a purchase I authorized. So, being aware of what those potential risks are on a blue sky day, but also on a day when, emotions and, you're disrupted, the community's disrupted, it's important. So not clicking on links in text. The government will not contact you through social media ever. And scammers may try to offer you these like very unique, advantages, or you got to sign up today or it'll go away forever. Verify any information before you agree to something like that. Ask a trusted person, ask them to see references, verify them with government authorities. All that is really important. And again, verifying any solicitation for charitable donations before you give. So I wanted to talk briefly about evacuating versus sheltering in place, because I do understand that evacuating is no small endeavor for many people, especially when you're unsure about what might happen. So again, I'd say when you're thinking about the decision to evacuate, it's really important to do a strong assessment of your risks. So this is just one question to think about of the many, is do you have, the resources to care for yourself without electricity, water, without EMS, emergency medical services, for an extended period of time? I would say a careful consideration as you're thinking about your planning on what evacuation might look like versus sheltering in place. The decision around sheltering in place, I should say. So thinking about evacuation planning, I recommend learning about the types of disasters learning about the types of disasters and the sheltering plans in your own community, making that plan about how you'll leave and where you will go. It's a good idea to have more than one evacuation plan in the event that the original one is something that's not possible. Sheltering plans have changed because of COVID. That might be changing again, but keeping up to date on that is important. And then thinking about alternatives. If you do have to evacuate, a public shelter may not be your first choice, or anybody's first choice. So thinking about what feasible alternatives are is important. I mentioned I'd talk about pets. There's a growing body of research that is showing how critically important pets are in considerations about disaster planning and evacuation. And this picture is a picture I took in 2018 in Paradise, California, at the campfire of a pet shelter. And this was one of numerous pet shelters. So pets are, I want to say pets are people too, but not everybody thinks that. So evacuating with pets is something that many people do, and emergency planners are taking that into consideration. So in thinking about your traveling with pets or evacuating with pets or disasters in pets, having a designated caregiver, some disaster planning, like having your kit should include a solid supply of food, pet food and water, having your pet microchipped, having their immunization records as part of your important documents is important. And then having emergency supplies and a traveling kit for your pet, like a crate or an extra leash, are important things to consider about pets and disasters. So along with everything I've said is getting back to that continuum. So if you think about some of these things from the talk today and think about what the incremental steps that you can do today, I hope that you might put a note on your calendar for 6 months from now. That is a reminder for you to think about what other steps you can take. Review your kit, call someone on your family communication plan and ask them about theirs. Review if there's any other important documents to add to your kit. So I try to do that myself every 6 months or so. So I want to share as one of my final slides about disasters and mental health. And this was this is data from a research study that I did after Hurricane Harvey with home health nurses, asking them about how they provided care for their clients after a disaster. And this was what one of the nurses told me. And I'm going to read it because I think it has more impact if I read it. So she told me, "I knew that my family was basically okay, but my patients were not. My son lost everything in Hurricane Harvey, but I knew that we would be able to help him and he was going to be okay. So for that reason, I didn't worry as much about my family, but my patients, I can't fix those kinds of problems for them. And maybe when I grow up, I'll get to the point where I don't feel like I should." And she went on to say, "But I carried a lot of their stress. My most memorable patient was when I had to try to find her. And when I did find her, I was explaining to her or that I had been to their original residence, and she just started bawling and said the river took it. And it was truly, truly terrible because I was helpless to get her back home or any of those kinds of things. So I think that stress level was just tremendously high." So after a disaster, whether it affected you, on a huge level or a small level, emotional, physical, and cognitive reactions are common and normal. There's resources out there to get help, and often that starts with having trusted family members or loved ones or people relationships in the community where you can support each other. So last slide is an important part of preparedness and readiness is getting involved. These are two local options: the American Red Cross Disaster Services. There's the Washtenaw County chapter that probably many of you on this call are involved in. There's also the Michigan Volunteer Registry, where I encourage you to check that out as a way of giving back to the community, but also of learning more about disasters and emergency preparedness in your own community. So this is from the my closing quote from the United Nations Office of Disaster Risk Reduction. Just the point of this quote is about centering older adults as key stakeholders in emergency preparedness and in designing policies to better support not just older adults themselves, but the whole community. Thank you so much. This is my email and my Twitter, and I'm happy to, if anybody wants to contact me to talk more, but I'm also happy to answer some questions. So thank you so much for having me today.
Wow. Thank you, Dr. Bell, for a stimulating and awesome presentation of things that many of us have only heard about tangentially. You clearly have a huge body of both personal knowledge as well as research. There are a number of questions, but before we start the session, I want to remind the audience that this lecture series is a collaborative effort between Turner Senior Wellness Program, OLLI, Turner African American Services Council, Silver Club Memory Programs, U of M Geriatric Department, Institute of Healthcare Policy and Innovation, and the National Polling on Aging. And I don't want to have to read that again. I'll get it all backwards. Okay. So let's start with some of the questions. The first one is actually not a question. It's a statement. This is the first OLLI seminar I have seen with an actual hero. Thank you for your service.
Thank you.
Next question is a question. Can you send out those post-preparedness posters? I would have liked time to take notes.
I actually, I'm wondering if I could work with OLLI to send out some of those resources.
Mm-hmm.
And I know the presentation is recorded.
Mm-hmm.
I'd be happy to provide any references or information. Maybe we could talk offline about that with the talk organizers.
Yeah, Jen Howard is saying that Jen can send your slides with the recording, if you'd okay that. And Jen would be the one who could also see if some of those might be things that Turner could hand out. Okay, a question that you may have partially answered, but please say more about specifically what seniors can do to prepare. Is there something different that older people might need to consider that a younger generation might not have to worry about quite so much?
I do think that gets back to the slide I talked about with the definition of disaster, where for older adults, if you have some of those things are specific to you, like perhaps fixed income or chronic conditions, planning around those things is important. So let's say chronic conditions is one that is specific to you. That's where I recommend talking to your healthcare provider about the specific plans that you might need to think about around preparedness.
Mm-hmm.
I know that a number of healthcare providers and resources that for people with chronic conditions, let's say you're on dialysis, for example, there's an enormous body of information out there that can better support people with end-stage kidney disease. There's actually, it's called like CASE, or Kidney Coalition on Emergency Response. So the information, there's a world of information out there specific to older adults. Also, like the Alzheimer's Association website has emergency preparedness planning for people living with dementia. AARP also has specifics towards older adults. So I think to answer that, part of planning is to think about, what are some risk factors or things that I need to think about that are specific to my situation, and then seeking out those resources to build upon your planning. But I am going to say one other thing, not to belabor this question, is that there's an essential tenet in emergency preparedness that's called all hazards preparedness. And that is what emergency planners use as their kind of umbrella, which is having a plan for any hazard. So you have your basic structure of a plan, and then you can work on the subsets of the plans, like what do I do about a flood? What do I do about a cyber attack? Or, for me as a healthcare provider, I'm thinking about, in the healthcare setting, how do we need to think about some of these, any hazard, being ready for any hazard, and then individualizing some of that planning.
Mhm. So other people are asking about the slides after the lecture. So I think Jen Howard is well aware of that and is poised to send it out with the recording. You mentioned kidney dialysis, but another one that may be even more common is people who are on home oxygen. That
Right.
they would definitely need a whole set of series of plans on how would you handle that over a period of time.
Right.
So another question is, how far away should an evacuation destination be?
You know, that is a great question, and one that I'm a big fan of saying I don't know. And so I'm going to say, part of evacuation planning is having somewhere you and I, 1 to 2 locations identified where you believe you can be safe and have resources. So you might find that the disaster is the power went out in Ann Arbor and isn't coming back on for a week, but it's on in Saline. So going to stay in Saline is appropriate. But you might also find that you live in California and there are widespread wildfires and you need to go farther away. And that's one of those things where, sometimes planning is about the best laid plans that don't pan out.
Mhm.
So I would say that gets back to kind of the, that all being ready all for the, any hazard, and thinking about, like, we have talked about, my loved ones and I have talked about that I will evacuate. We have some places identified. I have an emergency preparedness kit. If going to 50 miles away doesn't work out, I have done some background education and can be prepared to extend those plans.
Mhm. It's a moving target sometimes. Someone's asking, how does one verify charitable solicitors?
So there is a website. I hope that it's easily accessible. One that there's a number of them that you can use to verify. One that comes to mind, I believe, is called Charity Navigator, charitynavigator.org, where you can enter the name of the organization and get some background statistics on it.
Mhm.
The other kind of like eyeball metric is, on first glance, is if it's a 501c3. So if they're a registered nonprofit. So like initially, if you see that it's a 501c3, that is an indication that this is a registered and approved nonprofit organization. And then it's worthwhile seeing if it might be in a online verification website like Charity Navigator. Not all of those will be.
Mhm. Okay. This may be a bit repetitious of what you covered, but they're saying, please identify or supply a good checklist of the essential items we should address.
Okay. That's a great point. And as I was preparing this talk, I thought, well, I could spend 3 hours or 8 hours on that. And so I really was trying to aim for the overall, but I'm going to type it into the chat. So ready.gov is that one-stop shop where run by I think FEMA, where you can download any number of information and print out any number of information about emergency preparedness, including checklists.
That actually answers another question somebody had. She misheard it as readiness.gov and couldn't find it.
Okay.
So it's ready, READY.gov.
Yes.
Is the correct one.
Yes. So that's where you can download a family communication plan, information about your pets, information about evacuation planning, information specific to older adults.
Okay, so I'm going to put that in a chat that goes to everyone.
Okay.
READY.gov. Ready, go. All right, now it can go out to everybody. Okay. Does Washtenaw County CERT still exist? CERT.
So as far as I know, it does, but I will say, my disaster response work is at the federal level, so I have not been involved in CERT.
Mhm. Okay.
So probably I'm not the best person to speak with informed about that.
But it might be, you could Google it and see. Yeah. Another question is there a local organization that will do a home survey to help you identify home structure readiness and best options for physical protection during shelter in place, such as a tornado warning?
There are a number of companies out there, some questionable, some not. I have not been involved in anything. I have not been involved in that, so I don't have one to recommend. One thing I would say is that if for people who are local to Michigan, that there's, I believe it's annual, like a preparedness. I don't want to call it a conference, but it's in expo. That's what I'd call it, where different companies come and, have their survival gear and their preparedness gear and their, like buckets with dried food. And that takes place in Birch Run at their expo center once a year or so. I've never attended. I've always been curious about it, but that's, if you have the interest, that might be one place to start checking out.
Oh, okay. Is there any way for people to obtain extra meds in order to have more than a week's supply at hand for possible evacuation?
That's a great question and a really troublesome issue. Quite often, insurance companies are challenging there, and there is in a area with a presidential declared disaster, or in the deployments that I've done where there's significant disruption, there was government-sponsored prescription assistance to allow individuals to get additional prescriptions. And I know there's talk at Medicare and Medicaid, the Centers for Medicare and Medicaid Services, about addressing some of that. And there's also, final point, there's also a emergency response organization that exists to support pharmaceutical. It's sponsored by pharmaceuticals to support individuals after a disaster in obtaining prescriptions, but it remains an area where there's work that needs to be done because of challenges around insurance providers.
I suppose one option is you could ask your primary care provider, whoever writes your prescriptions, to do an additional 30-day or 60-day supply, but you'd probably have to pay for it completely, as you said, rather than through insurance.
Right.
Another question, concerned about power outings. I even purchased a backup battery to charge my cell phone. Any other suggestions? And how much drinking water should we have at home? And how long is it good for?
Okay, so I'll start with drinking water. The minimum is 3 gallons per person per day. That doesn't include pets, and that doesn't include, flushing toilets and watering plants. There is if there's an expiration date on water, believe it or not. I don't know what it is off the top of my head, but on the other side of this wall is my water. I wish I could go check it. But when you do that every 6 months check, that's a good time to check what those expiration dates are and switch those out. Another thing that I think about a lot is a gallon of water at Kroger is around 79 cents, 85 cents. So, maybe on your, once a month, adding 1 or 2 gallons to your supply make it 3 gallons, then it would be one day's worth for one person. And then you can switch out with some of it that's been in there longer. About power outages, I think that's a real concern, and that we can expect more frequent power outages. So thinking about having backup power sources is really important. A battery backup for your cell phone is a great idea if you're keeping it charged. The other thing that I know that the technology is evolving a lot, has evolved and continues to evolve, is around a solar charger that can charge, you know, 2 or 3 cell phones, or, you know, something like that, over the course of its, you know, its solar battery life. And that is an area that, you know, is becoming less expensive and might be of use for those smaller devices like a cell phone. If you have devices that require medical, that are powering medical equipment, you know, I can't stress enough that you need to talk to your healthcare provider about having a backup power source for those.
Like a generator. So I've seen, I think the REI store in Ann Arbor in their camping area now has some of these solar powered energy systems for people who are hiking in the wilderness and have their cell phones. Of course, is there cell phone coverage there is a completely different aspect.
It's a great question.
And of course, if your car is available, most modern cars, you can plug your phone in and back it up, assuming that you have gas,
Right.
and assuming that your car wasn't destroyed in whatever the emergency was. Someone is saying, thank you very much for your talk. Next question or comment is, the Red Cross has a sound alarm program for fire alarms to install and check, and people can just call the Red Cross. And we're getting something in the chat that says there are solar powered generators. Google for the names of companies.
Interesting.
Okay. So probably a related question is, what are sources of electricity in an emergency when the power is officially out and expected to be out for a while to support medical equipment?
Having a generator, whether it's a permanent generator or a temporary generator, frequently actually now in any situation where there are shelters, there are charging stations or supports for people who use these devices. So that's where keeping in, as part of your emergency planning, knowing where those shelters are and what resources they provide is important. You know, in the event that there's a power outage and you have this equipment, then the local planners have specifically thought about people who need these devices charged or powered. Also, it's increasingly acknowledged how important communication is, and so charging stations at you know, where you can go get a hot meal, or at feeding centers, you can get a hot meal or water. You can also charge your phone without necessarily staying at a shelter. So those exist in those situations, or those exist in you know, in emergency response, like sheltering and feeding centers, warming centers.
Actually, one thing that we forgot to talk about is hospitals, because all hospitals have huge generators to produce electricity during power outages. And so
Right.
if someone has a medical device at home that requires electricity, then one fallback, if you can get to it, if you have a car to get to it, is to drive to your local hospital. And if it's a life
Definitely if it's a
they can plug
life-threatening.
you in. It may be in
Yeah.
a hallway, but
Yeah, could I say one thing about that? Is we didn't talk a lot about hospitals and healthcare, but Medicare, the Centers for Medicare and Medicaid Services passed in 2017 specific requirements around emergency preparedness for any healthcare organization that Medicare supports, which is, you know, the vast majority, that they have to have certain emergency preparedness plans in place, and certain, you know, items in place, like a staffing plan. They have to drill, and they get surveyed on that regularly if they're in compliance with emergency preparedness procedures.
someone is commenting that she uses solar panels and accompanying batteries to save home electricity, and points out that home gas generators are reliable but very polluting. I think she's talking
Right.
about the portable generators, but whole house generators are not as polluting as that. Okay. Someone's pointing out that drugs that are controlled are even harder to get for an emergency. And one option, if you can, if it's appropriate for your medical condition, is to skip one every now and then and save it. But that also depends on how long that medication is going to work. How about something called gas extra in case of lines that are too long? I'm not quite sure what she's saying there.
Okay.
Okay.
Oh, you know what I think that might be saying? In case, you know, we see when there's, you know, there's a rush to fill your car with gas and there'll be super long lines with
Mhm.
to get gasoline.
Mhm.
Some people may have the ability to store gas. You know, in my garage, we have a 5-gallon gas container, and that's about my family's capacity.
Mhm. It does have to be stored properly, though.
Right.
Yeah,
So storing,
you don't want to get a fire in the garage.
right.
So someone else is commenting about another option for communication. She says she uses a Garmin handheld while hiking that I use to send messages via satellite. So I had forgotten about that. I remember hearing about that.
Yes, I would say, you know, whenever I am deployed, Hurricane Maria, for example, cell phones were down and we relied on a satellite phone. That I think, from my knowledge, and one
Mhm.
thing, when I said I don't know, I would say there's a whole world out there about, you know, maybe just thinking about telecommunicate or communications in disasters. Um, and from my understanding, and maybe this person could say more, but is that, you know, the ability to have a satellite phone or satellite communication device can be cost prohibitive. That is my understanding. But so, like, for, you know, everyday use, or you know, in your emergency preparedness kit might be an option for some, might not be an option for other people.
Yeah. It'll be interesting to see how some of that develops over the next few years as we get more and more commercial satellites.
I
And
think the
whether
same
that
about
becomes a more viable.
like about solar powered devices, and you know, I think we will see more of that as well in emergency preparedness.
Someone else is putting in a suggestion for the name of one solar powered generator company, Generac.
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 That's how I say it.
I'm going to send this to everybody who's spelling it. Generark. Solar powered generator company. There. So
Oh, okay.
everybody should be able to read it in their chat there for the name of it. So it sounds like folks in in there that are signed into this webinar have a lot of different experiences with things that may be useful for others. Oh yeah, and somebody said, yes, the GPS units are pricey and require a monthly subscription. And then there's a question, do you know if AARP provides workshops for emergency preparedness? They used to give workshops about aging in place, but do they have workshops addressing the emergency preparedness topic?
If they have them, I don't know. I would recommend checking their website, and I would love to be a presenter if they do.
Okay,
Yes.
sounds interesting. Someone says they have used the Generac.
I feel like I've seen Generac, but
Yeah. Okay.
maybe there's two different companies.
People are sending in chat notices about the proper spelling.
Yes, but could I say one thing about how important sharing experiences and building a community is? You know, so like this is about lifelong learning, and when it comes to emergency preparedness, I hope to be a lifelong learner, and you know, don't know tons about GPS units. And so I think, you know, sharing knowledge and sharing experiences is really, really critical to, you know, helping build trust and community with other people.
Okay. And I think a final, well, couple of extra plugs. One person says satellite phones are roughly $300 to $400, but you have to have a subscription. And then some electric vehicles can supply power to a house in an emergency. And they picked up on that by watching the Ford pickup commercials on TV.
My husband is on the waiting list for the Ford F-150, which he's a selling point to me. He said it will power the whole house.
Until the gas runs out.
Oh, no, I'm sorry. It's an EV. It's an electric vehicle. It's called the Ford Lightning, and he's already been told he's not getting it this year. The list is so long.
But still, that battery has limited supply of electricity. It's not going to be able to support a house for days.
Right. I think, you know, there's a defined period, but I think, you know, you charge it in the station and it does reverse charging and then can charge the house and the car. My understanding. Yeah.
And we'll see what really comes out when these things, somebody's going to be trying this as soon as the cars are available. Okay. Let's see. If you have solar panels and the sun is shining, they refill. True. Michigan, however, has a lot of gray days in the winter. The last thing that I'm seeing here is fascinating and valuable presentation. Many thanks.
Thank you. Thank you so much for having me.
All right. Well, I don't see any more questions here. So thank you. Thanks from all of us to you for such a wonderful program. And thanks to the audience for joining us today. We had a very large number of participants. So we'll end the webinar at this point.
Do I stay on, Dr. Van Dyke?
No, you can leave.
Okay. Bye-bye. Thank you.